The difference between a heart attack and sudden cardiac arrest is often confused and not the same. In Kyle Brewer's case, the young athlete from New Paltz High School who collapsed suddenly at track practice, that was a sudden cardiac arrest and not a heart attack. It's important to distinguish between the two because, as Dr. James Lyons, Dutchess Ulster American Heart Association Board President, informs us, knowing what to look for may be what saves a life.
Typically, when we see this happen, we see this tragically happen in young athletes, it is usually a structural problem with the heart or an electrical problem with the heart. It's not what we call a heart attack, which is typically what we see when older people die suddenly. That happens when there's a blockage or narrowing in the arteries that supply blood to the heart, or a sudden rupture in a plaque in the arteries to the heart that stops the circulation and causes death of the heart muscle and can cause sudden death as well.
So what steps are schools taking to keep aware of the symptoms and signs?
Both the American Heart Association and the American College of Cardiology have put out guidelines. All young athletes should have a basic screening exam done by their primary doctor. This would include a questionnaire about history of heart problems in the family, questions about any symptoms they may have, such as fainting or passing out or difficulty breathing, and then a good thorough physical exam that would pick up any potential signs or problems. If anything there is picked up as abnormal, they do have some problems in the family or they have some symptoms that may be concerning, then we'll recommend doing further testing, such as what we call EKG or electrocardiograms, or sometimes even ultrasound to look at the heart structure.
So getting back to heart attacks, caused primarily by hardened arteries, blockage, and plaque buildup, that's typically found in older people. But as our societal behaviors change, it's not always the case anymore.
Unfortunately, as we've seen changes in our society and a more sedentary population and more diabetes and high blood pressure happening at younger ages, we are starting to see the typical routine heart attacks even in some in younger ages. So the awareness has to be there for those symptoms.
All of this raises some serious questions. Are school personnel getting the up-to-date CPR training that's needed? And are there defibrillators readily available in schools, churches, and other places where large amounts of people gather?
Getting to someone starting a proper CPR as early as possible and early defibrillation has been shown to improve survival.
New Paltz was equipped. A student performed CPR on Kyle as soon as he went down, and a coach came over quickly with a defibrillator. So the hope is that with this tragedy at New Paltz High School, some good will come out of it, where Kyle Brewer's sudden death makes us all aware of what's needed to react quickly and effectively.